When palpating the musculotendinous structures of the medial foot and the plantar foot, we are going to look at first the tibialis anterior. The tibialis anterior is a dorsiflexor and inverter, so we are going to resist dorsiflexion and inversion. Don't let me move you. This is going to be the most obvious one of them all at the ankle. It's a huge tendon that runs dorsally and medially to the ankle, anterior to the medial malleolus. So we palpate that, and our obvious bony landmark for palpation is our medial malleolus, anterior to that. And relax. Don't let me move you. And it pops up really nice and big there. The next one is going to be another important one. It's more important than most people give it credit for, is the tibialis posterior. It runs around the posterior side of the medial malleolus and behind the tubercle of the navicular bone. So our bony landmarks for those will be between the medial malleolus and the tubercle of the navicular bone. Right in between there, we're going to place our palpation fingers, and I think you'll be able to see it, so I'm going to have her contract first. We are going to resist, it is a inverter and plantar flexor, so we are going to resist inversion and plantar flexion. So don't let me move you, and relax. All right, I'll bring it out here. Don't let me move you, and relax. You can actually see that tendon right there between the medial malleolus and the tubercle of the fifth. But when we're palpating it, we just simply place our fingers in between those two structures and strum it. Relax. Don't let me move you, and strum the tendon. When she relaxes, that tendon goes down. Don't let me move you. So we just palpate on the medial side two structures, the tibialis posterior and the tibialis anterior. We are actually going to palpate in this position two other muscles. One muscle we will actually not palpate, but just feel for the contraction of the toes. We simply ask the patient to curl the toes under, and relax. I simply then add a little bit of resistance to see if it's working properly, and I just concentrate on toes 2 through 5. I don't worry about the hallucis toe or the big toe. That one I am going to test for, so I just tested for the flexor digitorum longus. I am now going to test for the flexor hallucis longus. This one I can palpate on the medial side of the foot, just underneath the first metatarsal. So I simply have her curl her big toe like that and give some resistance, and I can simply strum that. And now try to curl your toe. Don't let me move you. And I can actually, I want you to hold it for a while. And relax. And don't let me move you. And I strum that on the plantar surface of the first metatarsal. You can actually feel that through the full arch of the foot. And that is the flexor hallucis longus. We're going to switch legs and move to the more of the dorsal and lateral aspect of the foot and ankle. The first one we're going to do is just lateral to the tibialis anterior, and that is going to be your extensor hallucis longus. We simply ask the patient to lift up their big toe towards their nose. Lift your big toe up towards your nose. You can actually see it on most patients. This is an important structure because we are going to palpate the dorsalis pedis or pedal pulse from orientation of this tendon. So our palpation point will be on the dorsal side of the first metatarsal. Don't let me move you, and I simply strum that back and forth with my palpation fingers. The next one over will be your extensor digitorum longus, and I simply say lift your toes up towards your nose, and I add a little resistance, and you can actually strum all those over the metatarsals of the foot and feel all of those tendons, and there's 4 of them. Going over one more, if you have one, not everybody has one, is we have the Peroneus tertius. Peroneus tertius hooks to the posterior side of the fifth metatarsal at the base. And so we actually have them dorsiflex and evert. It's a dorsiflexor everter. Contrary to the Peroneus, longus, and brevis, which are a plantar flexor and everter. This one is a dorsiflexor and everter. So if they have one, you'll see a tendon coming on the anterior side of the lateral malleolus down towards the posterior side of the tubercle of the fifth. So go ahead and lift your foot up and out. Now she has a very, very small one. Most people have a bigger one. I don't know if you can see it there, but it's a small little dinky baby tendon that goes right there. But I can actually palpate it because I can strum it. Moving to the posterior side of the lateral malleolus, I am going to palpate one above the lateral malleolus and one below the lateral malleolus. The one below the lateral malleolus, because they actually switch places as they come around the lateral malleolus, is the one below the lateral malleolus will be the Peroneus brevis, sometimes called the Tibialis brevis. And that is going to plantar flex and evert the foot. And if you can plantar flex and evert for me, you can actually see that tendon right there. You can't see it on everybody. So your landmarks is the tubercle of the fifth and the lateral malleolus. And we are simply going to strum the tendon between those two osseous structures. The next one, we will actually palpate the beefy part of the Peroneus longus, and we will actually feel that above the lateral malleolus with pure eversion. Now she can plantar flex if she wants, it doesn't really matter, as long as we get that eversion component. So go ahead and plantar flex and evert, and you can see that tendon and the beefy part of that tendon above the lateral malleolus. Now they switch places right underneath or right behind the lateral malleolus. So just remember, if you're palpating the tendon above the lateral malleolus, you are palpating the Tibialis longus or the Peroneus longus. If you're palpating between the tubercle of the fifth and the lateral malleolus, you're palpating the Peroneus brevis.